Texas hospitals collectively hold about 8,826 intensive care hospital beds. All numbers Texas Governor Greg Abbott saw earlier this week.
That I was impressed with the number of beds that already exist.
But looking further at the state's information, scroll down. The intensive care hospital bed count quickly drops. Here, we see almost half of the hospitals don't have any allotted beds at all. Many of those hospitals are rural.
We really struggle in rural Texas.
Texas Department of Agriculture Commissioner Sid Miller is in charge of the Texas State Office of Rural Health.
Many of them just need cash to keep the doors open because they're kind of overwhelmed and understaffed.
The average distance for someone out in the country to reach a critical care center, 35 miles. Miller says it's even longer of a drive for some folks.
Sometimes it's more than 100 miles just to have a baby.
Texas Governor Greg Abbott announced a temporary waiver for hospitals, so hospitals can set up tents and increase bed capacity, but still doesn't solve all problems for our hospitals.
Frankly, the biggest challenges most hospitals are concerned about is staffing.
The nursing unemployment rate nationwide is only 2.5%, so it's hard to find workers. The Department of State Health Services shows a shortage of nurses in Texas. Plus, the skills for healthcare workers are specialized. Not all nurses can treat all kinds of patients.
There's a critical shortage of doctors, nurses, pharmacists all across rural Texas.
The governor's waiver also allows healthcare workers from out of state the ability to practice here. That's if their own state doesn't need them.
There's 10 ways you can get this virus. There's 5 on your left hand and 5 on your right hand. So wash your hands and don't touch your face.
In Austin, I'm Erica Proffer.